And imagine this is a healthcare organization, acute care and so on, based in the Midwest, an integrated delivery network of about 8 hospitals. And I'm going to walk you through a procure-to-pay example. I've deliberately chosen a more complicated one that spans more products so I can show it off. Obviously, they're normally simpler than this. And obviously, the goal here of their applications is to reduce the cost of care, maximize the quality of patient outcomes, and that's really what we're after. So the example you see here is, again, we're on the Mingle homepage that Charles showed you, and this here is a maintenance director. And this hospital is running our enterprise asset management application to manage all of their biomedical machines across the hospital, and they're using predictive maintenance. So based on our software, they can predict when a machine is going to go down. And in this case here, you'll see on the top left-hand side that James has had an alert that's been posted to Mingle that came from EAM's predictive maintenance module, and it says failure is expected on an MRI machine at one of their hospitals because the knee coil is predicted to fail inside it. So again, you can go up to this, and in context, it drills him straight to the underlying application, asset management. And it brings him up to the event screen inside asset management that shows him all of the maintenance events associated with this MRI machine. And again, we have in-context business intelligence on the right-hand side. And on the top right is actually an in-context business intelligence application that's powered by data from Cloverleaf, which, for those of you who aren't familiar, is our healthcare integration platform for clinicals. And what it's showing is the usage of that MRI machine. And you can see that it's used an awful lot. So one, it's a very important machine to the delivery of care. But they can also see that in December and February, obviously something happened to that machine because the usage dropped to 0, which obviously is very disruptive to both patient flow and the delivery of care. And he can see that when he looks at the events in the middle here, that both times in December and February, it was because this knee coil inside the MRI machine failed. So at this point, James is thinking it's probably a better idea to actually replace the knee coil versus just fix it again because it looks like it's breaking on a pretty systemic basis. So next, he has an in-context app here as well below, the Cloverleaf one, that basically shows him the budget in context. So if I'm going to replace it, do I actually have the money to do it? Okay? And he knows the knee coil costs about $22,000, so yes, he can afford to do that. So he clicks on the parts associated tab, which shows him all the components of the MRI machine, highlights the knee coil, and what you'll see over here is on the right-hand side, we have this kind of quick wizard requisition adding context app. It's kind of interesting because this is an EAM app running in context inside EAM. And what it does is it automatically populates all the fields associated with requisitioning this knee coil, and it's like Amazon. It's one click, and he's done. So James clicks on the submit button, and what it does is Ion picks up that transaction, that XML document, the requisition, feeds it into S3 supply chain module, and it also drops it, creates a workflow task for Danielle, who is a purchasing agent in the purchasing group. So this hits the middle column. You can see at the top, she gets a process requisition for this knee coil. Okay? So again, she can click on this, and for her, it drills her into her application for this, which is the S3 supply chain module, and it brings up to the requisition screen, and it fills all the details in. And again, she can see the in-context budget. Yep, we've got budget for this. But what else she sees is in the top right-hand side, she has an in-context inventory management application. And by the way, they happen to be running our warehouse management system, which is also integrated to S3. But she can see that actually this knee coil is actually in stock at their central distribution center. So again, just like Charles said, you can go up and you can use Mingle to share this. So she says, hey, instead of buying this, why don't I just see if I can get my hands on that knee coil? So she requests, shares it with the inventory group and says, hey, our radiology department needs a new knee coil. I see you have one in the central DC. Can we take it? By the way, we've got budget for a cost transfer. So this hits Henrik's post, who's the inventory manager that's responsible for this central DC, and he says, no, I'm sorry, Danielle, the coil's already assigned to, to an MRI in our Springfield hospital. So Danielle's like, okay, that's not going to work. I'm actually going to have to go buy this. So she goes into our strategic sourcing module, which is integrated to S3, and the requisition is all filled out. And she's basically going to put this out, to bid. The system automatically identifies, in this case, the 3 vendors that are approved to bid on this knee coil, and she hits submit and creates an event. The vendors all come in onto our vendor portal, for this case, Associated Health's vendor portal, and they all submit submit their responses to the bid. And this is the first vendor. And they're actually saying, look, I think I can get it for you today. Danielle did say it was urgent because we know the machine is predicted to fail and we don't want to disrupt the delivery of care. So they all submit their bids. Danielle gets a post on her Mingle feed saying, hey, the bidding process is complete. She drills from there and it takes her in to strategic sourcing again, where she can compare the 3 bids from the different vendors. And she notices that while the quote from the first vendor is not the cheapest one, it's the one that she can actually get fulfilled the fastest, and she doesn't want to disrupt delivery of care. So she decides she's going to award business to that vendor. So she goes in and she says, let's award that business, and clicks submit. Now what happens is approver is implemented at this healthcare organization, and it picks up a policy violation. The lowest cost vendor was not selected in a requisitioning process. And this here is Donna, who happens to be the VP of supply chain, and it hits a Mingle alert, hits her iPhone, basically saying exactly that. An approver audit violation has been detected, and she says, okay, I'm going to go ask the purchasing department and Danielle what the story is. So again, Mingle is mobile as well, and she shares that back and says, hey, why didn't we pick the lowest cost vendor? This hits Danielle's news feed, and she basically says, hi, Donna, it was an urgent request for the MRI due to high demand, and these guys had the lowest bid, so we picked them, and the requisition goes through. And what you just saw there is we're using S3 at the core, integrated to a broader suite of applications, all running on Ion, wrapped in a Soho experience with Mingle to change not just the experiences that we're delivering to people in healthcare, but fundamentally to maximize patient outcomes and reduce the cost of care. And that is 10X.